Hi there, it's Claire from Clairified Creations, and you guys, it has been officially 1 year since I started working as a pediatric nurse. I thought now would be a really good time to share with you all what it's like to be a nurse, what it's like to be a pediatric nurse, all the things that relate to nursing, because my goodness, this year has been crazy and very just new and different than what I expected. So if you all are also going into pediatrics specifically, this can be applied to general nursing as well, but more focused in peds since that's my specialty. You guys, you are definitely going to want to hear some of these things because I have learned a lot in my year and I'm still learning, but I wish I kind of would have known some of these things before going into it, just so I would be a better nurse and be more prepared for my families and my patients. I graduated from the University of Tennessee Knoxville back in May of 2023 and have been working at an outpatient setting since, and it is a general clinic, so we see everything from allergy shots to the flu, COVID, RSV. We give vaccines, we do nebulizers, blood work, caths, which are rare for our office, but we have had a few of them. Preface this video with saying I come from a very, very busy office, typically over 100 patients per day, so it is quite chaotic sometimes, so I did kind of have to get used to a faster pace, but all of these tips will be very nice to know. Let's go ahead and get into the first thing. So I wrote a list on my phone just so I wouldn't forget anything. Number 1 is bringing patients back. You kind of never know what to expect. Some kids are easy and some kids are just not, and you get all sorts of in-betweens. So when you bring a patient back, something that I kind of had to learn and realize that's very different from the adult world, kids often don't understand a lot of things that you think would be common sense. So you would think that they would go in and step on the scale. Sometimes it's just not, it doesn't process for them at all, so you have to explicitly tell them, take off your shoes, step on the scale. And sometimes they still stare at you like, what in the world are you saying? The blood pressure cuff. We have an automatic blood pressure cuff in the clinic I'm at, and it is always a disaster. It, granted, is on its last legs, and I'm not kidding, 50% of the time it won't work. Even if you're completely still, don't move anything, it just comes with an error, so we do need a new machine. But when I started, it wasn't quite that bad. With blood pressures on the littles, I have stopped doing the electronic one for all 3-year-olds and most 4-year-olds. The reason being is kids just cannot sit still for anything. A lot of them don't understand. You have to put your arm just relaxed. A lot of them will flex it. And I've had kids, hold their hand up there and you just kind of have to guide them. And a lot of times I will move their arm and put it by their side and show them. So that's something to also know, that if you're going into peds, blood pressures, honestly, should probably just be done manually on the ones that are really young, 3 to 4. We just start them at 3. We don't get them beforehand, so that is kind of nice at least. Be patient with them and explain what it is, how to do it, and hopefully by their teenage years they'll understand to be still and don't move. But anyways, if they're little, just go ahead and grab it manually. Another thing going off of that is you have to explain, especially to the younger population, I'd say really 9 and less, maybe 8 or less, is it's an arm hug. Because if you tell them it's going to get your blood pressure, they will most likely freak out because they hear the word blood and they think it's gonna hurt. And then if you say anything like tight squeeze, sometimes I will say squeeze depending on their age, but if they hear squeeze, they automatically associate it with pain, and you don't want them to associate things that should not be painful with pain because they're going to a doctor's office. Sometimes there are painful procedures like immunizations, which I will talk about later. But just so you know, try and avoid blood pressure unless they are old enough to understand it, to avoid any unnecessary worry regarding that. I feel like that was a lot, but very helpful to know. First thing is just grabbing their vitals. Kind of stemming off of that, tip number 2 is when you're listening to heart rates or having to do any sort of assessment. I have found for 2-year-olds, they do not, I'd say maybe 15 months to 2 years and older, they do not love getting listened to with their heart or their lungs, anything. As a nurse, we're required to get heart rate and respiration rate, and we do that manually at our place. So we listen with the stethoscope for 15 seconds, 15 to 30 depending on how old they are. If they have an irregular rhythm, of course you're always able to listen longer, but standard is 15 seconds. And some kids do not tolerate 15 seconds. It feels like the longest 15 seconds of your life because they are very squirmy, for one. A lot of the infants especially, they don't want to be attached to anything. They're crawling around, they're moving around, they're crazy. And you love them, but you also have to get your job done. So something I found is if I listen to them and gently put my hand over their back and kind of place them so they can't move. And if they do start moving on me, I will try and move with them. So if they start walking, I'll start walking too. Whatever you can do to get an accurate heart rate. It's not always ideal. You have to bend down, you have to get on their level. And a way to mitigate their anxiety, because I want to talk about this, some people, as soon as you put the stethoscope on their chest, lose it. It's very traumatizing, or maybe they've had a traumatizing experience in the past at the doctor's office. So they see you in scrubs and start screaming. In a way I have found it doesn't always work, because some kids, nothing works, and only thing that would get them to calm down is leaving. It is showing them what you're gonna do before you're doing it, and it's a very great tactic to use. If they are anxious, you just show them on mom. So say you're gonna listen to their heart rate, I try and get the parent involved, and I put the stethoscope on the parent and I tell the kid, you know, sometimes they don't understand, but at least they can see it and realize that it's not gonna hurt. Mom's not crying. Put it on mom. I'm like, look, mom's doing it. See, she's not being hurt, just listening. And a lot of times if you do that, or if they bring a stuffed animal, I'll put it on the stuffed animal and just be, oh, look, they're doing a really good job. Now it's your turn. All of that, mom, stuffed animal, they still are screaming and crying. I'll show them on me as well to try and just build that up, build that relationship up. I do want to say I love being in the pediatric world. It's been so good. I just want everyone to be aware of certain challenges and to how to take unique approaches to facing those challenges to be the best nurse you can be. I am by no means an expert in anything. I do want to mention that again, but it's been really, really sweet. Kids are cute too, which is a very big perk you don't get with adults. Another thing I was thinking about just now is a lot of kids are afraid of the scale. It's just a big thing. If you're a 2-year-old, stepping on the black box can be very scary. And sometimes you have to weigh both the parent and the kid together and then put the kid down and weigh the parent, because it doesn't work. And they'll get on the scale, they'll start moving their feet like this, screaming and crying. And half the time it's really not worth it. You don't want to add any extra stress to the visit. So that is always an option. If you're finding it too difficult to weigh them, just try and do it the other way. It'll be a lot easier. Some parents are not too excited to get on the scale. They have given me several looks, but I look at them and I say, it's either you get on the scale with your kid and we weigh you, or we're here for 10 minutes trying to get a weight on your kid that's not going to be accurate. So normally they will cooperate and say, okay, let's just go ahead and do that. Tip number 3 or 4, I don't know, I think we're at 4, is don't be afraid to get the doctor involved or a coworker. So say sometimes in the winter it can be really long waits of waiting for the doctor to come around and see you because it's sick season, everybody is sick, everyone comes in at once, and you're concerned about a kid. I have had a few, probably a handful of kids that I have looked at, brought back, and thought, this just doesn't look good. They don't look like they should even be in this office. They look like they need to go to the hospital or go to the ER. And especially if it's anything with breathing, if they're labored breathing, trouble breathing, they're gasping, if they're really wheezy, I normally will either get another coworker to come in and assess with me, or I'll go straight to the provider and I'll ask them, I'll say, hey, I think you really need to see this patient. And I have done that a few times, and I've been very thankful that I have. Or if you see someone just in a lot of pain that you think is abnormal, and if they're screaming and crying and something looks off, you definitely know when you see those kinds of patients, because they don't come around often, thank goodness, but when they do, it is concerning. And you never want to delay care for something that could be an emergent issue and there's non-emergent ones in front of them. So don't be afraid to go up to a doctor. When I first started, I was so terrified to say anything to the doctors because I thought, oh my goodness, they're over me. I'm just a little new grad nurse, and here I am telling them their patient is having trouble breathing and they should go see them. But at the end of the day, you all are a team and you guys work together. Thankfully, I have had an amazing experience where I've been at where doctors and nurses are always collaborating. We have several nurse practitioners. We have all sorts of people, medical assistants, that we just all work together and aren't afraid to tell each other what our thoughts are. And another thing is, what's the scariest part is pulling a doctor out of a room while they're seeing another patient. I was very, very hesitant to do this because normally it's just been, oh, I see you in the hallway, let me grab you, you should probably go see that patient. But when they're in with someone else, it kind of adds that extra level of you better be right, because you're pulling them out of another patient's room, saying bye to that visit, putting them on hold, and rushing into the other. But I have done that, I want to say only once. That kid ended up going to the ER. It's always better to trust your instincts than to wait and then something bad happen. For the kids that are under 2, at our place we always get naked weights. So that's diaper off, clothes off, everything. And that can be a pretty sad thing for a lot of kids because, you know, it's not fun getting undressed and being cold and you're all cozy and then you're just stripped of all of that. So what I like to do, if I can, or if I remember, I just thought I'd put it out there, is try and listen over clothing for their heart. If you're able to hear it really good, if it's a baby that's 6 months old and you know they're gonna cry as soon as they get any of their clothing off, try and do that beforehand just to minimize the crying and minimize it to a shorter period of time, and I bet the parents will be thankful. Like I said, half the time I forget about their heart rate until after they're undressed. Next thing I want to talk about is medicine. Medicine can be your friend, and it can also not be your friend as well. It kind of depends. With medicine, a lot of times we'll just give, you know, Tylenol, Zofran, prednisolone, all the syrupy things. With Tylenol, I try and tell the kids, you know, it tastes good, it's going to help you feel better. Try and explain what it is. That way they're more likely to take it and take it well. There are some kids that are not good medicine takers and you have to use a syringe. Usually, even if they're about 3 or so, still using a syringe might not be too bad of an idea, because I went in for one patient, I don't remember how old they were, thinking that I could just give them a cup, and it turned out mom said that they would take it better with a syringe. So I would really say your syringe is probably your best bet for littles, 3 and under for sure, unless you know and mom or dad tells you otherwise. A syringe, just pull it up and then just squirt it in their cheeks and try and do a little bit of a time, get them to swallow. Put your thumb under their chin, so that way their swallowing reflex is initiated, because I did not know about that. I saw a mom doing it and I thought, oh, that's so smart. Just put it under your chin to get them to take it. A lot of times they will try and be moving their head like this because they don't want it. And if you kind of have parents hold right here, that way you can just squirt it a little bit and then hopefully most of the medicine will get in there. A lot of times if they're old enough, I'll try and tell them, you know, it tastes like grape, it tastes like cherry, it's sweet. Or with the Zofran, something good to kind of note is they're kind of weary about the Zofran because it's a dissolvable tablet, at least the ones we have. I tell them it is not candy, but it tastes like a Smartie. So I say, have you ever had a Smartie before? Most of them say yes. I said, well, it kind of tastes like that. It tastes sweet. It's some medicine to help you feel better and to help you stop throwing up. And normally that works pretty well. And I kind of do think so. Zofran tastes like a Smartie, in my opinion. Okay, our biggest topic here and the biggest learning curve for me personally was vaccines. I did not realize how difficult giving kids vaccines would be. There's a lot of, controversy over vaccines and everything. As a nurse, I want to say I am 100% for childhood vaccines and giving the rotavirus one, the Prevnar, pneumonia, measles, mumps, rubella, chickenpox. Definitely think that it should be done, and in our office, I think most offices, they're mandatory. So I wanted to share a little bit about my experience with that and some tips that I learned from the other nurses there to help you as well. Now for kids, probably, I want to say 8 or under. It depends on how big the kid is, but a typical 8-year-old I feel like is kind of small still, usually around, I don't know because I was a small kid, but going based off of weight, I'd say 60 pounds and under. I usually like to do the leg, and if they're over that, I kind of give them a choice. If they're in between, I say, do you want arm or leg? And then of course, if they're over 90 pounds, it's always arm for me, usually, unless they request otherwise, which I have had some people do. So with those vaccines, for kids that are movers, honestly, even for the babies, what I do is I have their legs, I have them on the exam table. And I learned this from other nurses. I do not take credit for this at all because it is very smart to be able to do it this way. The nurses at the office told me about this. So you put them on the table, they lay down, and then their legs, so here's the table, and their legs are dangling. So where their knee hits, that's where you want them to be, at the very edge of that, so their legs dangle. They lay down. Mom and dad hold their arms, so if they are anywhere from especially 1 to 5 or so, 1 to 6, I tell mom and dad, I say, hey, it is very important that your kid does not move while we give these vaccines because it is an open needle. There's a very high risk of needle sticks and injuries, and you want to prevent that as a nurse, and you don't want to get stuck either. So you hold their arms up here, and you make sure they have a good hold. I always try and confirm. I say, make sure you have a good hold and do not let go. Because some parents think that, oh, you can just hold them up for a second, and as soon as I start giving them, they let go. And I think, what in the world are we doing here? We cannot be doing that. Anyways, they're holding up here, their legs are here, and they're dangling. So I'm going to show you. You put their legs in between your legs right here, so your knees are around them, and you lock them. So they're laying down like this, knees bent over the edge of the table, your knees are around them, and you press with your thighs. So that way, if they try and wiggle, they can wiggle as much as they want, but normally that hold works really, really well because you can keep them still enough, and also it does not hurt the child. I want to put that out there. That sounds very horrible to have to pin them down like that, but you have to think about it as the benefits of doing this versus not. And they're getting vaccines that are life-saving. They save other people's lives, they save their lives. So it is a lot laying them down. They don't love it. I'll just be real. No kid loves to lay down. As soon as they start to lay down, they know they're gonna get shots and they get upset. But that is personally the best way for me that I've found holding, and sometimes I can't do it, and it's okay to get another nurse in there to hold. I have had to do that several times because I'm on the smaller side, and these kids are stronger than me. So it's, in that case, if I have someone else holding, I'll have them hold legs, and I will just focus on giving the vaccines. So where you want to give them is in the vastus lateralis for the legs. So you kind of find the biggest part of the outer muscle. I'll show you right here. And you want to go here and here. So just kind of on the outermost lateral aspect of the thigh, and just give those vaccines. You never want to go too far to the side where, you know, the sciatic nerve, or there's almost no way you would hit that with the way they're sitting. But even so, you just want to hit the outer part, and I try and do it, you know, obviously spaced apart and everything. If you are able to space them one on each leg, that is more preferable than doing two in one leg, just in case any reactions do occur. For sub-Q, it's usually in the arm. So you might be wondering, at 1 year old, we give MMR and varicella, which are subcutaneous injections under the fatty part of the skin. I know some offices do it in their arms, but I have personally never done that. I always do the leg, but just at an angle, at a 45-degree angle. So it's still sub-Q, but you have better control over the legs. I don't know how anybody really is able to get a 1 year old to cooperate and do it in their arm, unless parents are bear hugging them. But I've never tried. I have had parents ask me to be holding their kid while I'm giving their vaccines. They want to hold their children. I have said no every single time except for one. There was an exception because I had someone else in with me, and that was sort of the only way it was going to get done. But 99.9% of the time, I tell parents no for a reason. I understand that it's hard, but like I said, for safety reasons, I never want to tell them yes and then they get stuck because they're moving, and then that's just a whole slew of paperwork that I don't want to deal with, and I'm sure they wouldn't either. So I tell them, you know, you can pick them up right after their vaccines. You can still be holding their arms. You can be talking to them. There are ways to mitigate anxiety. And with the ones that understand what vaccines are, that's very hard for some of them. For the 4 and 5 year olds especially, it is very traumatic for them. And I understand that. So some tips I have is to use fun band-aids. Try and show them, oh look, once you get this, you're gonna have some really fun band-aids. So that is some way, because some kids just love the band-aids and the stickers. You tell them, afterwards, I'll get you a sticker. Afterwards, you can have a popsicle. To try and give them a reward for being good. Kids love food, so anytime a popsicle is involved, they are more likely to cooperate. With those vaccines, I will be honest with them because a lot of them will come into the office saying, am I going to get a shot? And I never want to say no because there's always the chance they're behind schedule, their parents want them to have a flu vaccine, anything at all, and sometimes I know they are due for them. So I never tell kids no. I said, well, you know, we'll have to see, but no shots right now. We're just getting your height or we're just getting your weight. And they will probably ask you 100 more times after that. But that is a way so they don't start getting anxious in the moment. You never want them to be just thinking about that all visit. So I don't know if it's better to tell a kid before they're getting them. I think it is, but you have to be careful with how you word it because some kids know they're getting a vaccine and that's all they ask you about the entire visit, and it's a lot for them and a lot for the parents because they have to keep hearing, and when am I going to get my shot? I will tell them, I'll tell the kids, I'll say sometimes, yes, you are. If I walk in and they ask me, what is that? Tell them, I say, so I got you some medicine. It's going to make you stronger and it's going to go in your legs. I've got 3 pokes for you. So they can kind of understand what's going to happen. And then they're saying, oh, is that a shot? And then unfortunately you have to say, yes, those are shots. I try and call them pokes because pokes are nicer than shots. Just be honest with the kid. I found out it's so much better for them and the parents if they're knowingly gonna get something instead of blindsiding them and then they freak out 10 times more. Want to put this out here as well. If you have an older kid that is not cooperative, because you will get them, teenagers, sometimes it's the teenagers, just do it in their leg. If it's not going well or if they flinch, it's so dangerous for you and them because they might get stuck in the wrong place. If they start flinching or they'll move and scoot or if they see it, and are anxious about it, just kind of stop what you're doing, and if they're small enough to get it in the leg, go ahead and offer it in the leg so you have more control and can put your legs around theirs so they don't move. Quick little thing about calling parents and answering questions. I know I do not have all the answers, but as a nurse especially, parents look up to you and start asking you all sorts of questions about their kid. For instance, what kind of formula should I use? Is this normal? Does that look normal? Should I be giving them this? Should I not be giving them this? And a lot of times, I'll be honest, I don't know the answer. Or they'll ask me the name of a medication and I will say, oh, let me check on that for you. And pro tip here is you have a computer, use your resources. That's what I have learned, is to just make sure before I say anything, I never want to tell the parent a wrong thing. So I will either kind of research it on the computer or I'll ask a coworker. I never say that I don't know. I will just say, let me get back to you. I'm going to go check on that, or that would be a great question, but for the provider, because they know more about your child's situation. For formula, I don't know what their history is. I can't make a suggestion because I'm not comfortable with that. For one, I don't have any kids. I don't know nearly anything about baby formula except for the things I've kind of picked up on at the clinic. And that's not really my place to make that suggestion because I don't know that child's nutritional needs. The last few things I want to mention is to involve the kids with their care, especially for their well examinations or their well checkups. You'll be asking, oh, what kind of milk do they drink? And you're normally asking the parents, oh, do they do this? What grade are they in? Something I always try and do is kind of include the kids in that. If they're not old enough to know if there's any family history of stroke or heart disease, I definitely don't ask that. But if they're old enough to say what grade they're in, I say, oh, what grade are you in? Or what clubs do you do? Or what sports do you play? To try and get them involved in their care because it's so important for them to feel included because ultimately the visit is their visit. They just aren't able to communicate all the things and answer all the questions. And if they have siblings, try and ask, oh, what's your name? What's the sibling's name? Or I like your dress, or I like your hair bow. Complimenting is really good and a good icebreaker. If the kids are shy, they're more likely to trust you and open up. Last bit of advice I have for you all, if you are entering pediatric world, is to be patient. There are so many things that require patience, and kids are by far something that you have to learn patience with. You have to understand that they're not going to understand everything, and that's okay. And you might have to do things multiple times. You might have to get creative. You could feel like you're getting nowhere with this kid and it's gonna be all day before you get to your next patient. Just remembering your reason why and why you went into nursing and why you're with kids specifically is so good. That is pretty much all I have for you. Pediatric world is fun. We have the best coworkers and cute kids, and you see some amazing little outfits, especially on the babies. If you are going into pediatric nursing or nursing in general, comment down below and we can talk about really anything nursing related, or if you guys have any questions, anything I didn't mention, feel free to leave them down below. But I will see you all later. Bye!